Hello, Don here. Welcome to Podiatry Practice Mastery. We're helping you get your practice to the $2 million mark and beyond. A couple of things that have been on my mind, what I've been working on. One is I'm working on an urgent care presentation. So I've been seeing many patients coming from the urgent care with issues like ingrown toenails that they only got an antibiotic for, or like a missed Lisfranc injury, or other types of things. So what I did is I used ChatGPT to look in the research and find out what are the most common missed type of diagnoses in the urgent care, and I'm putting together a presentation for them, and I want to offer that to the urgent cares. So as you would imagine, Lisfranc is number 1, Achilles rupture is number 2, high ankle sprain is 3, lateral like a talar dome injury, stress fracture in the navicular, and then Charcot arthropathy. So these are some of the things that are most common. I guess I've seen also some infections, right, that aren't treated, and they kind of send them over here. So my desire is to set up a presentation for them and kind of reach out to the urgent care, say, hey, I'd like to do this little kind of like the 8 most commonly missed diagnoses and treat them, and how to treat them, or when to refer, basically when to treat in-house and when to refer. So what's interesting is when I did this search on ChatGPT, I asked to do it kind of Hormozy style, and also Chet Holmes. Chet Holmes is the guy that invented the idea of the Dream 100. So basically it's a way of reaching out to these referral sources until they get back to you. So I'm gonna kind of work this out, and then I'm gonna have probably the virtual assistants get their addresses and then try to set up appointments to go over this, even via Zoom. I could do this presentation for them via Zoom one-on-one, or even send them a recording of this. Anyway, so that's kind of what I'm working on today in between patients. This was a Friday. First half of the day was seen by Marjorie, so I'm not really including any of those. I'm just going to include some of those that now are kind of pertinent. So one was an 82-year-old female. She had routine care done, but she also had a 4th digit hammer toe bilaterally, and so I set her up for flexor tenotomy. So those are going to do that in about 3 weeks. And there was another woman that was 63. She had 2 carry flex, one on the left hallux and one on the 5th digit, and it was done by Marjorie, which made me really, really happy. That was the morning. Afternoon, there was a 42-year-old man with left cellulitis. This was coming from an urgent care. So this gentleman, I think he got bit by something, and they put him on 2 rounds of antibiotics. Didn't really work. Sent him over here. He wasn't in a surgical shoe, so I put him in a surgical shoe. The cellulitis is coming down. He's going to soak it. I'm going to see him in a week. And I gave him my phone number. Like these type of things I get a little concerned with, that it could get worse. Next was a 60-year-old female, number 6 out of 6 for left Achilles for her shockwave. She's doing much better. And she was also scanned for orthotics. So that was orthotic 1 of the day. And she'll be seen back in 2 months. That'll be the orthotic follow-up as well. Next was a new patient, was an 88-year-old female, routine, and she had a bunion. So the bunion was the office visit and then the routine care. New patient, meaning that's why I send out on a non-routine time. Next was a 43-year-old female, number 6 out of 6 for posterior tibial tendinitis. And also she got her orthotics dispensed to her today. So I dispensed the last visit, and I'm going to see her back in 6 weeks to see how the PTT tendinitis and the orthotics are doing. Next was a 21-year-old female with flat feet. That was orthotics number 2, and her whole family had orthotics, and so she just wanted an orthotic. Next was a 66-year-old female that had 2 issues. She had a plantar fibromatosis and then like an extensor tendinitis. She really didn't want to do any treatments, and so what I found is if patients don't really want to do the shockwave, I'm going to see her. I did a lidocaine patch, which kind of bumped up it because it was prescription, and it's a kind of a 2 stable chronic issues. I'm going to see her back in 6 weeks, and I said, well, if it's not getting better, we'll do the shockwave. Next was a 31-year-old female, number 3 out of 3, for bilateral Achilles, and she's a self-pay patient, and she's going to come back in 2 months. So that was the last one because she had previously done shockwave in the past, and it helped the other condition she had, so she wanted it again for this Achilles. And she only did 3, that's why she did 3. And then next was a Sievers child, 10-year-old, and I did phase 1. So if you look at my treatment sheets, there's a way with Google Docs you can add tabs. So I have like the old version and the new version with this is phase 1 and phase 2. And I'm thinking this phase 1 and phase 2 is going to make it a little bit clearer for patients. So they knew like initially try phase 1, and if it's not getting better, go to phase 2. So if you want to see those, you can go to my treatment sheets and take a look. And the last patient of the day was a child with wart, and I did cantharidin. And they had an interesting question. They're like, hey, can we do like a for HPV injection for plantar warts? And I guess that for some recalcitrant ones, there have been some studies of that, but I said no. I've never ordered that type of a vaccination for plantar warts. But that was the day. Today was a good day. I did upload a lot of new podcasts, and just so you know, kind of my workflow. When I'm recording the podcasts, I do it on my phone, and then I upload it to the Spotify. But then I take the transcript, and that helps me make like the emails that you get once a week. And it's basically just the main points of the podcast. And then also the description of the podcast, I do it with ChatGPT, both the description and also the email that's sent out. So just kind of letting you know how my workflow is going. So I am kind of excited next week about getting more of these follow-ups. That's one of the struggles I'm going through right now, is like following up with the no-shows and the canceled appointments, trying to get my office to do that. Okay, until next time, hope you guys find this beneficial. Have a good weekend.